The role of technology and innovation in healthcare is changing. The COVID-19 pandemic has created a need for future healthcare emergencies. We need investment and collaboration to roll up health and wellness centers to ensure healthcare access to all. On the top of it, states' preparedness to implement National Digital Health Blueprint, NDHB. To discuss this further, we have aligned a panel of subject matter experts on the topic State Health Blueprint, Policy Framework for Building Future and Resilient Healthcare Infra and Healthcare Delivery System. I would like to invite T. Radhakrishna, Editor, ET Government, to navigate this further.
Welcome to today's panel discussion, State Health Blueprint, Policy Framework for Building Future-Ready and Resilient Healthcare Infrastructure and Healthcare Delivery System. I am joined by Mr. J. Prakash Shivhare, Commissioner, Department of Health and Family Welfare from Government of Gujarat, and Mr. K. Bhaskar, Commissioner, Department of Health and Family Welfare from Government of Andhra Pradesh, Mr. Naresh Hasija, Associate Vice President, Public Health India from Mylan Pharmaceutical Company, and Mr. Sharat Chandra, President, Government Blockchain Association, India. Gentlemen, please welcome to today's panel discussion. I would like to start with basic understanding about COVID-19 pandemic approach. I would like to ask Mr. J.P. Shivhare, sir, did COVID-19 has strengthened the practices of public health care in Gujarat today? One, and how do you evaluate current pandemic situation in your state?
Thank you for inviting me in the discussion. I think this is a new virus, so everybody was not knowing how to deal with this. So even the World Health Organization was not knowing, they were revising their guidelines very frequently. And we are also in the process learning a lot of things. So our doctors were not aware of this virus. So when it started first, a major focus was on controlling it. So lockdown was there. We are doing extensive screening. But when we have that we were able to delay onset of first case in Gujarat. We have our first case on 19th of March. And at that time, our Honorable Chief Minister declared that we'll be establishing dedicated COVID hospitals, because this is a new disease and nobody was aware how to deal with this. But one thing was known in last 2 months, that it's a highly infectious. So we have to have dedicated facilities, and we have to take all steps for prevention, in infection prevention. I think never in past infection prevention has got so much of attention, and so all these practices have to be brought in our system. A lot of training was conducted for our healthcare personnel, and we also found in the initial phase there will be some lacuna in the system. So because now it's highly infectious, so relatives of the patient cannot be allowed to go inside the wards. That posed new kind of problems. We need to increase nursing staff, attendants, all those things. We also need to give a lot of information to relatives of the patient, because sometimes what was happening, a patient was admitted in the hospital and they were totally cut off from their relatives, especially if they were moved to ICU, then they were not in a position to talk to their relatives using their own phone. So some kind of arrangements were made to ensure that they can have video call assisted by our staff who are inside the ICU wards. So there are new challenges, and it took us to establish certain practices. Now we have to also establish clinical management protocols. So in fact, Gujarat was the first state to come up clinical management protocols for COVID. And later on, we kept on revising all these things. So in the process, we have learned a lot of things, and that has helped us strengthen our public health system. Infrastructure gaps were there. These were identified in the early stages. Then government took a very proactive stage. Government has constituted one committee, and that committee was given all the powers to do any kind of procurement by issuing short-term tenders, or doing one-day tender, or taking rates from any other state, or if things are not available, then go out of way to ensure that there is no shortage of supply of drugs and equipment and everything. So that way, government has taken a lot of steps, and in the process, our health system has been strengthened, and now we are in a much better position to deal with this crisis. I think biggest gain has been that a lot of things which were not getting attention earlier. Main thing being that everything has become now patient-centered. Sometimes earlier we were probably not paying enough attention to non-clinical aspects, like what kind of food, water, cleanliness is there in the hospitals. But now all these non-clinical aspects also got equal attention. So I would say now we paid a lot of attention to food quality, that after every use, toilets have to be cleaned. We have to ensure that mineral water is supplied so that, water itself doesn't become source of, infection. So all these practices have come in the system, and these will remain with the system. So that way, public health system has been greatly strengthened due to this crisis.
How do you evaluate the pandemic situation right now? And did COVID help you to strengthen your practices?
Sir, there are two parts to your question. One, you are asking about the current evaluation of the pandemic. So right now our state, I would call, we've reached a condition where the number of cases that we have has been, almost the same for the last 1 month. So we have been doing very extensive testing. In fact, as all of you know, per million testing, we stand first among all the states, not considering the union territories. So that being, even after testing so extensively and all the suspected cases, we reached a condition where the number of cases have plateaued and many districts have started showing a declining trend. That is one thing. And second, through our efforts, we have been able to keep our fatality rate way below the national mark. The number of cases we get is quite high due to very extensive testing. Our case fatality rate is one of the lowest in the country. So that I would be the summary of the current pandemic situation in the state. The second part of the question, sir, that you have asked, whether COVID has, helped to improve the situation. Yes, sir, definitely. So the investment in the public health sector and the infrastructure that we have across the country, I wouldn't name one state, across the country is far short of what it should be. That was the status in our state also. For example, when the first wave of people who started coming from abroad, who landed in this country, so we didn't have facilities for testing persons. That is the status in many states. So the initial days we used to send our samples to Pune to get them tested. And I was just already indicated, from that state of not having even a single laboratory which could handle a COVID test. Today we are doing around 70,000, 75,000. On some days we even came close to 1 lakh tests a day. That itself has shown that though our initial infrastructure was weak, there was an inherent strength in the system which could rise to the occasion and take up the challenge. So the number of oxygen beds that we had pre-COVID for the entire state was around 3,500, and the ventilators we had for the entire state was around 200. Today, I'm happy to say that there are around 5,000 ventilator beds, and we can accommodate around 8,000 people in ICU, and 34,000 oxygen beds are available, apart from other beds, non-oxygen beds available. So within a short period of time, the system could actually cope up, which shows that the system had an inherent strength always. And in crises, our systems do actually have come up to the extent of the imagination of the people. And we took it as a challenge, and we not only improved infrastructure in hospitals in terms of physical infrastructure by putting equipment, X-ray machines, ECG machines, and whatnot So much of machinery was put in place that there is no doubt. We don't get, calls from anybody saying that this equipment is not there, this equipment is not available. So much have been pumped into the system. Not only in terms of equipment, we took this opportunity in the state to recruit a large number of manpower. In fact, for only for COVID, just ad hoc staff recruited by the state of Andhra Pradesh is close to 30,000. So around 6,000 nurses, 5 to 6,000 paramedics, and then doctors to the scale of 5,000 doctors, and lab technicians everywhere we recruited. Apart from that ad hoc recruitment, we ensure that today, sir, I'm proud to say that in Andhra Pradesh, there are no vacancies of any medical staff anywhere, not even a PHC, not even a sub-center. We have filled up every vacancy. We've also not filled up every vacancy, but we have made all our PHC to work 24 into 7 by ensuring that there are 2 doctors in every PHC and 3 staff nurses working round the clock, so that any patient who goes to a PHC, even in the middle of night, is taken care. And this is going to be a long-term thing. So the doctors who have come in, nurses who have come in, paramedics, lab technicians who have come in, we strengthened our lab in such a way that for the last 4 months, COVID samples were being taken even at our PHCs and even at our sub-center level. So any person could walk into a PHC and sub-center and get his swab taken. So we improved our sub-center infrastructure, our PHC infrastructure in so much so that the long-term effect would be definitely a nice thing to see, because for the last 10, 15, 20 years we've been hearing shortages. There is a shortage of doctors, shortage of gynecologists, shortage of anesthesians. Even in now mufsil areas, we have anesthesians, we have radiologists, we have general physicians. We took this opportunity to even take gynecologists, obstetricians everywhere. Definitely helped us a lot. We pumped in a lot of money. We took this opportunity to start thinking about medical colleges. In fact, pre-COVID, the number of government medical colleges we had was 11. Now we started planning and work has started on 16 new medical colleges for the state of Andhra Pradesh. From 11, we are straight away going to 27. So because we felt that there was a large number of gaps in the infrastructure in terms of manpower, in terms of infrastructure, and this was felt, and then the equipment was brought in, buildings were taken up, and the infrastructure was put in. And I think for the next 10, 15 years, we need not look back at infrastructure as an issue, as a bottleneck for taking care of healthcare needs of the people. That is what COVID has taught us. And in fact, I take it as an opportunity that COVID has actually helped us in ramping up our infrastructure in such a scale. In a normal times, I don't think with the kind of things we have, the kind of procurement procedures we have, and the kind of obstacles we find in decision making and all, everything has been thrown out of the window, and efficiencies were brought in, and we could ramp up every infrastructure up to the village level, sir.
How do you evaluate the public healthcare situation, COVID and non-COVID? And did COVID situation give an opportunity for state governments to strengthen their public healthcare systems across the state?
Absolutely no doubt in that COVID-19 has basically brought out the chinks in the armor, if we may call for healthcare armor, uh, primarily in the urban areas or the urban settings, the big towns where the municipal corporations are there. There, in general, what I have seen is in most of the states, including Karnataka, the health department will be there and the municipal corporation will be there. And the number of health staff which is available in these corporation areas is abysmally very low. So, in fact, it's a wake up call for all of us that the health benefits and the public health system in the big corporation areas, in the big towns, should be strengthened per person or per 1,000 persons presence of your field health workers, in terms of ashas, in terms of ANMs, in terms of nurses, doctors. that should be increased. And that is not only the case with Delhi, Mumbai, Bangalore, Chennai, with every big city. This is one thing. It has also, I think, as a challenge, we should take it. It has given us a challenge and given us an opportunity to strengthen the public health system. And I think India has always done well whenever some challenge has been thrown at it. We built supercomputers because challenge was thrown at us. When we were denied food grains in the 60s, we came out with green revolution, then white revolution. So I think we can definitely work on this, and not only at this, in terms of industrial sector also, you are building APIs, you are now going for other things. So a lot of opportunities are there.
In COVID scenario, how do you see the role of Milan, especially in India?
First of all, let me congratulate two best state in India who have handled COVID very well. I think they have paved ways for other states to follow in different aspects. Coming to Milan, actually, we at Milan believe in serving 7 billion people in the world, and we really take pride in serving this population. This is our mission. And during COVID time, this mission has become more stronger for us, more meaningful for us. And overall, if you see pharma industry, we have really come to know the true potential of industry at this moment. The way essential medicines were made available across India, and you know that India is known for global generic of pharmaceutical medicines. And I think we have really proven this very well while serving our own country. Here, and we as Milan are serving these essential medicines to 165 countries. We are doing very well, and we have made sure, though no essential medicine is short in any of these locations. We do this by partnering with wholesalers, partnering with different pharmacies, partnering directly with state governments. In India, we have, in time of COVID, we have just now partnered with more than 20 states, and we are serving the COVID medicines to these states. We are doing a lot of CSR activities during this time, and we continue to focus on our production so that we really meet the need at this moment of all the essential medicines what we produce here in India.
Shivare, what are your priorities currently? I mean, many state governments are coming out with the temporary strategies for COVID, long-term strategies for the overall healthcare public healthcare is concerned. How the government of Gujarat is looking at what is the current strategy? What is the long-term strategy?
So as Mr. Bhaskar has already said, paid a lot of attention for capacity building of health sector. So now doctors, more nurses, more technicians. So everything is being ramped up. Procedures are being simplified. Then infrastructure is being created. So we already have 29 medical colleges in our state. We have now our MBBS intake is around 5,500 every year. So that is going to be increased further. And now a lot of attention is being paid to skill upgradation of our existing staff. So that is one aspect. Secondly, for COVID specific, we are paying a lot of attention to surveillance and early detection, because early detection is the key. If we can detect positive cases at the earliest stage possible, put them on treatment, then mortality can be avoided in large number of cases. So that is our focus. So we are deploying large number of teams in all the even rural areas, cities, everywhere to go house to house, do screening, do surveillance, and we are roughly conducting 75,000 plus tests every day. So idea is detect them early, and now our I would say doctors are much more confident to deal with this. Remdesivir and tocilizumab are giving good results, especially antiviral drug remdesivir is getting even good results. So we are now have enough supply of all these drugs, and treatment protocols are in place. These are being strictly followed. Every day is tele-mentoring. So in our Ahmedabad center, we have a state level tele-mentoring center. So all the medical colleges join from there. And in the afternoon, same day, all other centers join with their respective medical colleges. So they discuss all the cases, what is the condition of the patient, what kind of intervention is required. So they are getting the benefit of best doctors, even if patient is in the remotest corner of the state, they get the advice of best doctors in the state, and all of them are on the same page. So every patient is getting same kind of treatment. They are following the same protocol, same drugs are being used. So that is one thing. And these are the practices which will remain with the system. So telementoring, telemedicine, teleconsultation, all these things got big boost. Now, when lockdown was in place, people were not able to come out of their home. So we started one telephone helpline with the toll-free number 1100. So we started teleconsultation, and so they will connect to our doctors, and will ensure that drugs are prescribed and these are delivered to their homes, or they can collect from their nearest public health facility. So these are a lot of practices. Now we are also working on long-term plan for the department, how we need to make certain policy changes so that how to strengthen our system so that we can further boost the capacity of the department.
What are your current priorities, short-term and long-term priorities? Can you share, please?
Sir, our short-term and long-term priorities are absolutely in consonance with the short-term and long-term priorities of the government of India. So health and wellness centers is one of the priority, and I'm happy to inform that we are going to set up health and wellness centers in even the remotest villages of the state. So we are going down below sub-center level. Every habitation in the other state of Andhra Pradesh will have a health and wellness center, which is going to become a fulcrum of all the health and other related activities. That is one thing we are going to do. And in terms of the realm of digital health governance and health reforms and digital health records, we've already started the process. So right now, our process of collecting health data of each person in the state is going on. We expect it to complete it by the next 2 months. And then these are being done in the framework given for the electronic health records. So it is going to be a repository. I think we would be the first state to have a EHR repository on which all our health systems are going to be latching onto from the health insurance scheme which we have. We call it Arogyasri, where all major procedures are covered, and the regular health services from maternal child health services to the non-communicable disease, everything is going to be latching onto the same kind of a system, and we are going to have one unified system which will be absolutely in line with what Government of India has envisaged. That is what we are looking at the long term. In the short term, sir, we've increased the number of the medicines that which are in the minimum list. We have in fact increased it by 5 times, and to ensure that every drug is available, and our aim is to ensure that the out-of-pocket expenditure for everybody for whatever care is zero. So even the outpatient services are now covered under the Arogyasri. I think we would be the only state where even OP services are covered, where even the smallest of OP services are also covered. Not only that, in our insurance scheme right now, we are providing sustenance allowance also for the time they spend in the hospital. So a poor person walks into hospital, he is hospitalized for 10 days, his treatment is not only free of cost, but when he walks out for a prescribed period of time for him to take rest, we are even providing allowances for that person and his family. So we are going to that next level. And as we have told the physical infrastructure, all the public facilities, the PHCs, in fact, sir, I'm happy to inform that now we are going to have a PHC, at least a PHC. Right now, the current standard, whatever is there, we are going behind that and beyond that, and then we are going to have a PHC for every 20 to 25,000 population, and there has to be a PHC within 3.5 to 3 kilometers of distance from every households, both in rural areas and particularly in urban areas, because urban areas the PHC system and the sub-center system is generally weak. What we have done is that all our urban areas are going to have a PHC for population of every 25 30,000 population, there is going to be urban PHC which is going to run 24/7 with full-time doctors, with full-time paramedics, with full-time diagnostic services, so that out-of-pocket expenditure for even in urban areas is and zero. Then they are going to run on a 24/7 basis with full-time doctors and with experts available. And those are going to be our hubs which will be connected to our sub-centers, and our sub-centers are beyond what the government of India has is given the norms. Our sub-centers, we are going to have a sub-center so for every 2,000 population. So this is way beyond what government of India has mandated, so that these health services are available at every nook and corner, and out-of-pocket expenditure is nil. And our non-communicable disease infrastructure also we are ramping up. We recently started de-addiction centers in every of our area hospitals, and in the next 6 months we are going still down to up to CHCs. Every CHC is going to have a non-communicable disease clinic where your blood pressure, your diabetes, and other non-communicable diseases are all taken care, and free medicines and free diagnostics will be given to them at their doorsteps. We have deployed a fleet of vehicles, 370 clinics on wheel, which are going to do NCD services. They're going to visit a village every day and render services. And our ambulance fleet has been doubled now. We have a fleet of around 400 ambulances which work round the clock and which have very advanced life support systems and all. And our guarantee is that you call and within 10 to 12 minutes you will get your ambulance and transport you to the hospital. So the vision of our government is to take the health services up to the next level, and definitely we use this COVID as an opportunity, because generally the finance department always keeps its purses quite tight, and in COVID nobody can deny the health department the required services. So using COVID as an excuse, we opened up the coffers and got all this infrastructure in place, so that, as I have indicated earlier, so we don't have to look back and say that we don't have infrastructure, we don't have manpower, we don't have things. That is what COVID has taught us, and we will continue to do. And our lab infrastructure has been improved. We took it as an opportunity to improve all our TB testing. I'm happy to announce that now during the COVID time, we have deployed 400 new additional true not testing machines, which will be used for regular TB testing after the COVID is over. This is in addition to the 295 machines we already had. So that means now a TB test can be done even in a PHC. So, and then to operate those machines and all, now we recruited enough lab technicians to that every PHC has a qualified lab technician to do all this. So we use this as an opportunity to loosen the purse strings, and took it as an opportunity to improve the healthcare infrastructure that is going to help us in the long term.
Understanding the situation today, how do you look at what are your top priorities for the Karnataka?
See, one is obviously controlling COVID and bringing down the case fatality rate, or saving the vulnerable is our top priority. And for saving the vulnerable population, all of us know are the elderly, those with heavy comorbidities, the tuberculosis patient, the HIV patient, those whose immunity is compromised. That we control the epidemic from or pandemic from spreading. Number one, see that our vulnerable population is safe and secure. Whatever it takes, we are doing that, so that we bring down the fatalities and save precious lives. On a long-term goal, we want to strengthen the system, and towards that end, we are ramping up the infrastructure at the level of hospitals, at the level of public health, starting from the lowest sub-center to the highest level of care. We have been doing a lot of strengthening work. Uh, we have put a lot of oxygen supported beds. We are putting a lot of oxygen plants, and not only this, we are providing a lot of other infra also in the hospital, and that is surely going to help strengthen the public health system. And we had been doing pretty well in the Ayushman Bharat Arogya Karnataka scheme, the Ayushman Bharat scheme or the PMJY, where in Karnataka we call it Ayushman Bharat Arogya Karnataka because Arogya Karnataka was started and it got merged with the Ayushman Bharat. And many features of the original Arogya Karnataka scheme have been continued there. And at the Government of India level, we have been appreciated for 4 or 5 very good initiatives that we have done in the scheme to see that this scheme further benefits the hospitals and further strengthens the system. So these are the long-term goals are obviously to strengthen the public health system, strengthen the public health institutions in terms of capacity, in terms of their ruggedness to face any such pandemic in the future. And at the same time, our traditional goals or SDG goals, which are there of bringing down the IMR, MMR, of improving the vaccination, all those continue.
I would like to know Mylan's role in the field of medicines. Can you elaborate on that?
Thank you, Radha. I think, as you know, that this was a very difficult situation and normal supply chain and the normal process of people meeting the system was not working. So I will say that here we fully went on digital supply chain. We have utilized all our possible expertise being in Bangalore. You know that it's an IT hub. And basically we have collaborated with a lot of IT companies, small startups, to come up with a robust digital solution. And we reached out to all the state governments directly. And let me admit that, and let me say that the response was fantastic from their side. They wanted to work with us directly, and maybe I will say that in shortest span of time, we were bringing, because of this digitalization, our turnaround time was very, very low with them. Coming to about the preparedness of around this disease, I think we started early for preparing for this disease, and I will say that in the month of March, our whole backend team, R&D, regulatory, manufacturing, they all collaborated in such a way, we connected all the dots quite a long before. And coming up with a drug like remdesivir so fast in the market was not easy. I must thank Indian regulators through this message. I think they provided approvals unprecedentedly fast, and we could serve the nation, and most of the state governments we served directly. Now we work with almost 20 state governments here in India. While working this on this platform, I think it's most important for all of us to really take care of our employees. So the kind of discipline culture we imbibed from beginning till now, we are following the same, and most of our employees are safe. Their safety was our utmost priority. So we followed that. And then the most important thing was to reach out to doctors, reach out to corporations. We followed all the possible digital routes. We provide a lot of safety gears to our team in case they are going to the marketplace. So, and with this, I will say that response of digital is really, really very good for us. And we adopted this quite early at the time of COVID.
What is your analysis in the latest 5 to 6 months? How the governments are adopting technology, especially comes from the blockchain. Can you able to share a few details on that?
Sure. Thanks, Radhaji, for this question. And I would like to bring few pointers from what's happening around the world as far as blockchain is concerned, and how governments in India can take a leaf out of their success stories. For example, I'll give an example of, let's say a patient has been diagnosed with COVID, right? So, and if at all there's a reinfection, so health passports can open up another route to normalcies or coming back to normal. And as the governments across the globe are looking for travel bubbles, so if people are moving from one country to another or one state to another, if we have a uniform standard of, let's say, a digital health passport, which even Mr. Nandan Nilekani is advocating, we can bring a lot of sanity to the way data is standardized. And since Mr. Hasija talked about the supply chain part, right? So they have come up with medical track and trace solution on blockchain, which can be easily deployed on Amazon. So these are very light solutions. They do not require much of development, easy to deploy, easy to scale because they're supported by Amazon. And so these solutions can help governments in managing their medical supply chain, to be precise, and even even get involved in the responsible disposal of medical supplies, because we are generating PP kits in huge numbers, right? So we can use blockchain to track and trace medical supplies, medical equipments, PPEs, and create a more robust and resilient supply chain system. We can also look at clinical drug trial on blockchain. I mean, all stakeholders, be it pharma companies, be it regulators across the globe, they can share data in real time, and that will open up areas of innovation, right? So that no one is holding, let's say, proprietary data or data which can be shared easily with other stakeholders, so that drug discovery can happen in quick time. So these are some of the areas, and especially on, if you look at the National Digital Health Mission part, there are various areas where blockchain can be utilized. For example, the digital KYC for healthcare. There's one segment on that is for consent management as a service. So recently, local circles, they came out with a survey saying that 60% of the people are okay with having a digital ID, but they have apprehensions about the way data will be shared.
For 2020 and 21, Government of Gujarat has allocated 11,215 crore for healthcare for Department of Health and Family Welfare. Do you think this is sufficient for the current scenario, for the current financial year in dealing with the healthcare subject?
Yeah, I think when this budget allocation is done, government does, detailed exercise. So during this COVID crisis, we got a lot of support from government. Like government has told us to go ahead with whatever expenditure has to be done, but there should be no shortage of drugs or HR or any kind of infrastructure. So all the COVID care is free in Gujarat. So there are some private hospitals also who provide on payment basis, but whosoever wants to come to our system, it's absolutely free. And at the same time, what Gujarat has done, we have also engaged private hospitals in a big way. So we have reserved 50% of private hospital beds where government-sponsored patients will be treated at par with the paid patients. So again, we are paying a lot of money to private hospitals also, because idea was that there should be no shortage of beds in the state. So this model has become extremely successful, and then later on it was also endorsed by Niti Aayog as one of the best practices. So there is as such no shortage of funds, and whenever we need more funds, I think government has shown that willingness that health will not face any problem of funds.
So are you joining National Digital Health Mission? Is Gujarat given consent to National Digital Health Mission?
Yeah, we will definitely join, and I would like to highlight two or three things. First of all, PMJ, and before that, in fact, we have just completed 8 years of our Mukhyamantri Amritam Yojana. So that was, even before PMJ, this was our own scheme, which was launched in 2012. And so we are covering all the BPL families. When PMJ was announced, government has enhanced the income limit. So now up to 4 lakh income families are covered in PM Mukhyamantri Amritam Vatsalya Yojana. And that way we are covering roughly 85% of our population. And we have all the records of that 85% population. Plus we have our own civil registration system, which is fully online up to village level. So all birth and death is fully online. You can get your certificate from anywhere. And then we have our state of health program. So all immunization, deliveries, everything is online. So a lot of digitalization has happened in the state. Now, biggest challenge is to bring all the platforms in, integrate all the platforms and bring into one database. And secondly, as Mr. Sarath was talking about data privacy, because a lot of people will be unwilling to give the data unless they are confident about privacy of the data. So these are the two major challenges. We are working on that. We have put up a team which is working on preparing blueprint for how to roll out this, and we'll definitely go with the Government of India, launch this mission in our state. Idea is to integrate all the platforms and ensure that this privacy concerns are concerns are properly addressed.
The government of Andhra Pradesh has allocated 11,615 crore, which is almost 54% hike this year, this current financial year for health and welfare department. What are your focus areas for this budget? And two, are you gearing up for joining National Digital Health Mission, which is being implemented by National Health Authority?
Yeah, I think for the second part of the question, I've already answered that we actually started off on that. As you said that we started preparing the layers of data. And as indicated by my counterpart from Gujarat, a large number of data already exists and we started integrating it. So that process is already implementation level. So I think in the next 5-6 months, we'll be able to have the base layers of data available onto which transactions would be written. And we are already following the framework given by Government of India during the collection of the data and then storage of the data, duly considering the privacy issues and all. Once the framework gets developed into a fully functional methodology, and I think our system would also be in a position to latch on to the same systems and deliver on that. That is the thing. Yes, regarding budgets, as I've indicated, this year we embarked on a major overhaul of our health system. So there is a generous increase in budget, and definitely this is a good budget for us, and we are looking at developing the infrastructure we wanted to develop. As you indicated, we have embarked on 16 new government medical colleges. We are revamping all our public health centers, all PHCs. We aim to get quality certification this year, all CHCs and all your area hospitals, district hospitals. We expect to get quality certification from the corresponding quality certifying agencies like NQAS and other related certifying agencies. So we want to bring all our medical facilities on par, at least definitely some of the best countries in the Asian continent. That's the whole aim. And then if everything goes well, the system will evolve into one of the best anywhere. So yes, the budget that has been given is generous, and then we intend to use the budget to the betterment of the department and take it to a totally different level. Yes, we do that. Thank you.
Thank you, Mr. Bhaskar. The financial year, there is a budget proposed by the state government and around 10,000 crores plus. Do you think that, just since your administrator would like to know, is this sufficient for current scenario? Perhaps that budget was proposed before the COVID situation. So can you just, even not going to details also fine, but just want to know your perception on that.
So I think I would like to thank the state government, our honorable CM, and the trio of health minister, the medical education minister, and our home minister. All of them have helped us together, the ITBT minister, where we have not been said no for any proposal which we have taken to the state government with a view to control the COVID, whether it is in the form of testing, whether it is in the form of putting additional oxygen supported beds, or cryogenic oxygen plants in the hospital, or the various equipments or the PPs which are required to fight the COVID. So the state government has been very, very supportive in our battle against COVID, and they have been very supportive in strengthening the public health infrastructure and public health system. My gut feeling is that we will cross 10,000 crores odd budget which the state government has given this year. In fact, our budget has been topped up with a lot of other additionalities which they have given. We have been provided with a lot of manpower. We have around 25% of vacancies in the health department. The specialist doctors you will not get in most of the states, the MBBS doctors, the nurses and all that. State government immediately agreed to fill up all those vacancies on a contract basis. Then we have to run the entire system of our oxygen supported beds, ICUs and all that. And for that, the state government agreed to sanction additional posts and all that. Almost till this point of time, 3,000 additional posts have been sanctioned, which is almost 15% of the strength of the department, 15-20% strength. So state government has been very, very supportive in our fight, and I think this year we will cross 10,000 crores in terms of our spending itself.
How do you align your priorities with the government's priorities?
Very good question. I think very apt for this platform. So we really seek help from state governments to plan a little bit better in case of medicines. Like if they have predicted models where they know that how much patients they're going to reach, and then they know that what will percentage is active cases, and there are clinical protocols globally available in India also. I think ICMR has already published. So these, based on that, they can easily calculate number of patients which will require the treatment going forward for next 2 to 3 months. This will be really helpful for us to plan it better here in the back end, because you know that it's not a disease for one particular state. This is a national problem, and all the states are like there is a competition of taking the medicine. So our request will be, a humble request will be from our side, if you can plan it a little better, I think this will be really helpful. We are anyway available for all the situations to every state. We are the first company who went ahead and said that we will be serving all the public health initiatives. We started partnering with, I will say, with all the state governments versus getting into the private market. So only request will be this. Thank you.
Sir, technology has become an integral part of the health, predominantly very high these days. Can you share one or two practices, use of technology, which are addressing your challenges in healthcare today?
So I would say we are going for a whole life cycle approach, right from the birth. Whenever birth takes place, hospitals have been authorized to do the data entry, and then it is authorized, and then they are able to issue a birth certificate from the hospital itself. So nobody is required to go to any office to get the birth certificate. And then all our records are being digitalized. So all the services, even before birth of the child. So we provide ANC registration. All 4 ANC services are provided, and we keep a digital record of that. Then all immunization record is available online. Then when child moves to preschool, Anganwadis, so all the services are now through online platforms. Whatever benefits are going, these are going to the families through DBT. Then in schools, all the scholarship, everything is through these ID platforms. And we are integrating all these platforms so that once registration is taking place. So now we are encouraging generation of Aadhaar at birth. So as soon as birth certificate is issued, we'll link that with the parents' Aadhaar number, and Aadhaar number is generated for the child. And so it's like life cycle approach, and all the services have to be seamlessly provided using that single platform, that single ID. So now Aadhaar provides that kind of feasibility that we can provide all the services, and more services are being integrated in that.
Thank you, Mr. Shuhari. I'll come to Mr. Bhaskar. Bhaskar, can you share one or two challenges which are addressed by using technology in your state?
So the challenges were the initial days. It's a new thing. The way infection spreads and all, we never had a precedent that we faced such kind of a challenge earlier. So all our healthcare system was not geared up to take up such kind of a challenge. That was the challenge. And in terms of technology, yes, technology helped us in initial days in collection of samples and getting results and ensuring that even today we are using technology to the biggest advantage. So we have decentralized testing in such a way that testing is, your sample can be picked up at home and you need not visit any lab to get your test result. The results you can get through an SMS for every person whose sample is taken, and you can download your test result onto your mobile in a PDF form, And then the moment you get your results, you will be positive result, you are notified, and your caregivers are notified, the local health department are notified, so that the person who is positive is kept in home quarantine. And after the 14 days period, another notification is given, and then once you are no longer positive, then you are free to move about your activities. The entire scheme of things is the entire data is managed digitally. At any point of time, a citizen can has the repository of whatever has happened to him. So those kind of systems we have put in place. So yes, technology has definitely helped us. Without use of IT technologies, it would have been humanly impossible to process such huge amount of data and monitor such kind of huge amount of cases that have happened in the country. Yes, technology did help us. Thank you.
Government of India on March 25th, they've enabled telemedicine as a practice accepted across the country. Keeping that in view, I'm sure Karnataka also is the forefront in using the telemedicine facility across the state. Could you just give a highlight on that?
Yeah, so Aptamitra Aptamitra is our state initiative on telemedicine and handling COVID cases. And again, that was in collaboration with the software bigwigs in Karnataka, and that has really helped us. Apart from a 104 health helpline which we have got, but in the coming days, what we have planned is under the Ayushman Bharat Arogya Karnataka, or under the bigger umbrella of Ayushman Bharat, where all these non-communicable diseases or NCDs are being tackled, and we have got these health and wellness centers. There we are planning that through our middle-level health provider, or MLHPs we call them here, or community health officers, CHOs as they're called all over the country. We are providing. We have already provided them the tabs. Some more people will be provided with the tabs, and the teleconsultation, telemedicine will be done, going down to the health and wellness center, to the grassroots level. So this has been planned already. A lot of things are happening already, and probably in the next 5-6 months we'll see a lot of traction, a lot of movement, and a lot of telemedicine and teleconsultation happening through technology, even to the last sub-center level. I think the healthcare is one of the most promising and one of the most dynamic sectors, and it has taught us, this present pandemic has taught us the immense use of technology in our daily lives. Whenever we can't move out, technology can bring us together. The way right now we are talking to each other. Had it been normal time, we would have met face to face. So similarly, technology can really help us. We are looking at all the startups, all the technology company to come and help us. We have identified certain pain areas, which are there in terms of our disease control, in terms of our public health challenges and all that. And we want them to come and fill up and give us the solutions. We are looking forward. We're really excited if we show some solutions. And IIIT Bangalore, Indian Institute of Sciences, all the big institutions are there, and I think they can collaborate, or if they come with bright ideas, we are always there.
Mr. Radhakrishna, I just want to add one more point. When we talk about quality in healthcare, there are 6 aspects to it. One is that it has to be safe, efficient, effective, timely, it has to be equitable, and it has to be patient-centered. Now, with the use of technology, all these 6 aspects can be addressed. So now we also want to promote technology in a very big way in medical education, because if we have best professors in our, suppose, BJ Medical College in Ahmedabad, any student sitting in even some district level hospitals which are being upgraded to medical college, even they can get the benefit of same kind of education that is being imparted in best college in medical college in the state. Now AIMS is coming up in every state. So technology has to be used in a very big way in medical education, so that we can maintain quality of medical education, similar quality of education in all the places. And then even all the patients. I have earlier talked about, telementoring and all treatment protocols. So every patient, wherever they are getting treated, they can get same set of treatment, same set of medicine, same set of care. So I think these are technology also equalizing force and also helps in providing timely treatment. And we are also keen to use telemedicine in a big way. So in all our health and wellness centers, we are promoting telemedicine and teleconsultation in a very big way. So all these things will lead to, will bring more equity in the society.
Under your national programs, like you conduct hepatitis and tuberculosis programs nationwide, is there any program that you would like to highlight on this platform?
Yeah, so as I said in our initial discussion, we are more of a public health company where we actually find solutions around all the infectious disease. So this is the mission we carry, and our R&D scientists are working in the direction. If you see around viral hepatitis, I think we created a huge difference in our country. Around HIV/AIDS across the world, we have done a good job, and now we have picked up a disease called tuberculosis. Particularly in tuberculosis, we are focusing on multi-drug resistant tuberculosis in a big way, and we will be coming up a very good solution in XDR-TB, which is like highly resistant tuberculosis. So we have taken two goals in this area. Like if you see a tuberculosis patient, he has to take multiple pills for a long duration. So some cases it is 10 to 12 pills for long duration of up to 6 to 10 months. So 12 months, 24 months, there are different protocols for different situations of the patient. So these two goals we have taken, particularly in tuberculosis. We will reduce pill burden. That is one goal we have taken, and I will say that we are working on the direction very successfully. And the second goal we have taken is we will reduce the duration of treatment. So similarly, we are absolutely focused to give back to public health in a big way. Now, as I said in COVID, I think I've discussed in detail about COVID. So these are few of our public health priorities where we are extremely focused in this space.
Yeah, thank you, Mr. Naresh. I'll come to Sharad Chandra. Do you see the role of blockchain or see already a part of any of the platforms in the country today, which have a potential to replicate in the progressive states in the country?
So technology does have a role to play, especially when it comes to linking platforms like, say, Arubshi, which Mr. Bhaskar pointed out, right? So which all stakeholders can have a single view whenever they want to, let's say, do any data modeling on that or make any decision based on that, right? So I think blockchain being a decentralized platform can make sure that the system is foolproof of attacks, because if you have a central system, then it's bound to have a single point of failure. So blockchain can make sure that the healthcare system is made robust against attacks. That's one part. Similarly, a lot of data has to be kind of actioned upon, depending upon whether it's coming from a certain source, which is, let's say, verifiable or not. So blockchain can be utilized to do a proper sanity check of the data. So that, and similarly, AI and ML models can be built on top of it. So the data source has to be accurate enough, and blockchain can make sure that we are getting in the right data into the system, because any model is as good as the data which comes into the system. So blockchain can play a really phenomenal role over there. And I do believe that with the current NDHM sandbox, there are certain components where blockchain can be utilized. Digital KYC for healthcare, where healthcare providers can be authenticated. So I could see a lot of areas where blockchain can be used, right? And especially for provider credentialing. Let's say if you have a registry for doctors, right? Why not use blockchain for that, so that you have the right people in the system? You don't have anyone who can fake a degree and get into the system, right? So registry for doctors is one area which blockchain can really bring a lot of value there.
Sir, ever since the government of India legalized telemedicine from March 25th, there's a lot of momentum on telemedicine. Most of the states have taken up. Would like to know Gujarat's telemedicine initiatives and your final words.
Okay, so we are already implementing telemedicine in all our public health facilities. So all PSCs are joined to through this e-Sanjeevani platform that has been provided by Government of India. And I think during COVID, it has got a major boost because people during lockdown were not, even if they have the facility, they would never wanted to visit any of the healthcare facilities unless there was an emergency. So a lot of people have taken benefit of that during this COVID crisis. And we also launched our own 1100 service. So that is just calling that's through telephone call. And we want to further, intensify it. We want to take it to all our health and wellness centers. So I think the telemedicine is the future. And we have also evolved a mechanism to dispense the drugs. And I think the way it is progressing in near future, I think there is huge scope for this. And now with digital health mission, it will be further strengthened.
Okay, I would like to ask Mr. Bhaskar. Sir, on telemedicine practices and your final words from Government of Andhra Pradesh.
So I think we were the first state to pilot the telemedicine. So, we have two systems of telemedicine. One we have been using for some time as part of the state government initiative. And just when the COVID has started, our e-Sanjeevani and has also started. So both the systems are working parallelly now. So what we have done is that one, we have now dedicated to the COVID because many times we find that, in smaller hospitals and all, due to COVID, our OPD was affected. So this gave an opportunity for people to use our telemedicine. Using that opportunity, what we have done is that an existing e-Aushadhi platform, which was developed by CDAC, which is available up to PHC level, we actually took it up to sub-center level. So now medicines are stocked and available at sub-center level, from where they can be dispensed. So somebody requires medical advice, he calls the telemedicine number, he is advised by the doctor, prescription is done online, and the medicines are picked from the sub-center by the ANM and delivered directly to the home of the individual, and we have a system of tracking. So I'm quite happy to tell that all prescriptions made by the doctors are delivered on the same day, not even to the next day. So it is as good as going to a hospital and getting medicine. So we use that opportunity to ramp up our system, and nothing was new. e-Aushadhi was already there. Sanjeevani OPD is already there, and drugs are already available. Just a little bit of tweaking and combining all the systems, so we could ensure that medicines are door delivered to the individual's house on the same day without having much of a logistics problem. So that was done, and it has been quite useful. We get a lot of calls every day, and the Sanjeevani is now on can also be done on a video call based. As is our system, we are taking up to a video call based system where a patient can be directly in video call with the doctor, because the feedback that we got is that patients are more comfortable if they see the doctor, if not face to face, at least on the screen, before telling their problems to the doctor. So that we have now rolled out, started, and I think that should be quite useful for the patients. This is from my side. Thank you.
I'll come to Mr. Naresh. State governments are innovating themselves to strengthen the healthcare systems using technology and recruiting the vacant positions and elaborating the complete to last mile connectivity. Do you see the newer areas where Mylan can take part in that, and your final words also?
So first of all, I think in India, COVID has given us a fantastic opportunity to really look into our healthcare infrastructure. Some of the states were very, very good in very, very advanced, like as Mr. Bhaskar said, they were already on track with the telemedicines, I think, and they were the one state which has given their PHCs were adopted, and there was a good public partnership models which were created in Andhra Pradesh. So I will say that, yes, this is good for each and every state to introspect and develop their own infrastructure to a level where we can really serve the nation. Mylan will be really open to look into the models and discuss this with the states where they want some kind of public-private partnership. From our expertise point of view, we'll be open to discuss this. We anyway are present in many of the states like Andhra Pradesh, Gujarat. Our factories are there. We have a lot of people who are employed in these states, and we are really taking care of their safety nowadays. So anywhere you feel like, yes, we'll be keen to come forward and discuss this.
Yeah, thank you, Mr. Naresh. I'll come to Mr. Sharat Chandra. Your final words on the blockchain integration with the state governments and central government healthcare systems.
I will pick from where Mr. Bhaskar has left, because he has highlighted a very important point. So your virtual healthcare, or let's say remote patient monitoring or telehealth or telemedicine, is going to be the future of medicine, I would say. And it will also include people who do not have access to, let's say, healthcare in remote areas. So that's one part. And how blockchain can really come into play is we can have decentralized identity management solutions, which will verify that, okay, he's the right doctor treating the right patient, right? So people who do not have even IDs for that matter, right? So even, let's say, refugees who do not have any ID to support themselves. So even using blockchain, decentralized IDs can be created, and even they can be bought into, let's say, the healthcare inclusion fold. So that's one area. And I do believe that remote patient monitoring or remote healthcare will be the future, and a lot of AR, VR, machine learning and AI will be fundamental to how drive transformation in healthcare. Thank you.
Okay. With this, we officially conclude our panel discussion, State Health Blueprint, Policy Framework for Building Future-Ready and Resilient Healthcare Infrastructure and Health Delivery System. On behalf of ET government, I really thank you, Mr. Jayaprakash Shivhare, Commissioner, Department of Health and Family Welfare from Government of Gujarat, and Mr. K. Bhaskar, Commissioner, Department of Health and Family Welfare, Government of Andhra Pradesh, Mr. Naresh Asija, Associate Vice President, Public Health, India, Mylan, and Mr. Sharat Chandra, President, Government Blockchain Association. But I thank you very much for giving opportunity to interact with you on this. With this, we conclude the session. Thank you very much, gentlemen.
Thank you, sir, for sharing those insights with us. You will have tons of knowledgeable sessions to attend and networking opportunities in the summit. A questionnaire will be circulated after every session so that you can share your feedback on individual presentations and panel discussions. Please stay with us for the next session.